Okay, so we're going to be doing a Perlane and Restylane injection. Both are hyaluronic acids, and we have a unique way of reducing the amount of pain and irritation, as well as the amount of bruising that you can get from these injections. The main way that we do that, or we address that problem, is we mix it with some lidocaine with epinephrine. I use a 1 to 100,000 concentration, and just for simplicity reasons, we like to do, or I like to do, a 1-to-1 dilution. So I get, for every 1 cc of filler, I get 1 cc of the lidocaine. The other nice thing about this injection is that by adding the lidocaine, it does thin out the filler, which decreases the incidence of lumpiness or unevenness, and it's easier for me to massage. And here's our patient. This is David. We're going to do the standard injection with the Perlane, which would be into his nasolabial folds today. Now, David's a good example for an injection in that he's got a very deep but thin wrinkle, which requires a dermal injection. But what we'll do first is we're going to do a deeper injection, and with the lidocaine, that's going to numb it up. And then we're going to come back and do a more superficial injection into the dermis. We're literally laying in filler and numbing the area at the same time prior to doing the more superficial dermal injection. Now comes our second pass. We're going to go more superficial into the dermis to try to bring out this wrinkle a little bit further. So this one is where you have to pull the skin a little tight. You can see the needle is very superficial, just into the skin. You can see as I'm injecting how the wrinkle is just popping out. So a bit massaging, holding pressure so that there's minimal bruising. Another great way of making sure you're not lumpy is to do kind of a bi-digital massage. So go ahead and open your mouth for me a little bit and just feel with your 2 fingers this way, just all the way up and down. And you can feel for unevenness or lumpiness. Make sure the injection looks balanced. We're going to actually inject a little bit around the area. You can see that this is all filled here, but there's also some volume loss out here. So I'm actually going to blend it in a little bit out here, so it looks more, we have a more natural appearance. We're going to just add a little bit of volume back here. So you can see the end result. There's some redness from the injection. More pressure there.